Embattled U.S. Representative Santos was drag queen in Brazil pageants, say associates. China braces for new COVID wave as Lunar New Year without restrictions approaches. Post-politics now, Treasury to begin extraordinary measures as parties posture over debt limit. Climate misinformation rocket boosters on Musk's Twitter. Liz Cheney, the Republican who fought against the GOP.
This is breaking news.
I'm Erin Burnett in Washington.
Embattled U.S. Representative Santos was drag queen in Brazil pageants, say associates. Sao Paulo, Reuters, U.S. Representative George Santos competed as a drag queen in Brazilian beauty pageants 15 years ago, two acquaintances told Reuters on Wednesday, adding to contrasts that have drawn criticism of the openly gay Republican congressman's staunchly conservative views. The embattled freshman congressman has also faced calls from fellow New York Republicans to step down over fabrications about his career and history. A 58-year-old Brazilian performer, who uses the drag name Eula Rochar, said she befriended the now congressman when he was cross-dressing in 2005 at the first gay pride parade in Niterói, a suburb of Rio de Janeiro. 3 years later, Santos competed in a drag beauty pageant in Rio, Rochar said. Another person from Niterói who knew the congressman but asked not to be named said he participated in drag queen beauty pageants and aspired to be Miss Gay Rio de Janeiro. Related video, George Santos is just emulating T___________ charmless Ron DeSantis turns off GOP donors, the rap. Emails to the congressman's press office and a newly hired communications director on Wednesday evening were not returned. Santos is the first openly gay Republican to win a House seat in Congress as a non-incumbent, but has positioned himself as a staunch conservative on many social issues. He has backed Florida's Don't Say Gay bill, which prohibits classroom discussion of sexual orientation and gender identity. Republicans are increasingly denouncing drag shows and performers, claiming they are harmful to children. Santos, responding in October to criticism of his support for the Don't Say Gay bill, told USA Today, "I am openly gay, have never had an issue with my sexual identity in the past decade, and I can tell you and assure you, I will always be an advocate for LGBTQ folks." Rochar said the congressman was a poor drag queen in 2005, with a simple black dress, but in 2008 he came back to Niterói with a lot of money and a flamboyant pink dress to show for it. Santos competed in a drag beauty pageant that year but lost, Rochar said. He's changed a lot, but he was always a liar. He was always such a dreamer, Rochar said. Reporting by Stephen Grattan, editing by Brad Haynes, Heather Timmons and Edmund Klauman. China braces for new COVID wave as Lunar New Year without restrictions approaches. With just days to go until the Lunar New Year, throngs of bundled-up travelers shuffle their way through the freezing temperatures towards Beijing Railway Station, the distinctive mishmash of Eastern and Western styles built in the 1950s to triumphantly herald Mao's new China. "We wish Beijing Railway Station all the best for the Year of Rabbit," shouts a group of youthful security guards, grinning while hoisting up red New Year's scrolls. Their crouching colleague preserving it on his phone for social media. There is almost a sense of normalcy until a lone traveler in a full head-to-toe white hazmat suit, one that had become so ubiquitous in China's age of COVID, scurries past, rattling the wheels of his suitcase on the plaza tiles. They are all rushing towards long-awaited reunions. This is the first Lunar New Year holiday, also known as the Spring Festival in China, after Beijing dropped nearly all of its zero-COVID measures and the first in over 3 years without any COVID-related travel restrictions. Chinese officials expect nearly 2.1 billion passenger trips to made during the 40-day travel period around the holiday, normally regarded as the largest annual human migration in the world, doubling the trips made just a year ago when Beijing dissuaded travel to prevent the spread of the coronavirus. Amongst the crowds is a Beijing-based office worker in her early 30s surnamed Liu, who is going back home to the northeastern city of Harbin for first time since the pandemic. China's massive wave of infections after its abandonment of zero-COVID measures appears to be ebbing just as the celebrations and reunions this coming weekend threatens to reignite a new wave. Liu, however, is not worried. She had recovered recently from the coronavirus, and her entire family and her friends back in Harbin have already been through a bout with COVID as well. The true size and scale of China's exit wave from nearly 3 years of restrictions remains unclear, as authorities abandoned the once ubiquitous mass testing regime almost overnight. Anecdotally, infections seem to have affected everyone, everywhere all at once. Scenes of long lines outside Beijing crematoriums and bodies having to be placed on the floor of hospital morgues because of full freezers repeated themselves in major cities across the country in videos circulated on social media, undercutting China's official toll of 37 COVID-related deaths for much of December. Space technology firm Maxar released satellite images of increased traffic outside funeral homes across China. One image of a funeral home in eastern city of Huzhou showed a significantly packed parking lot compared to images from a year earlier. When reached by ABC News, a worker there was dismissive, saying the situation was not the same as been reported by media before promptly hanging up. A study released by Peking University's National School of Development last week estimated that up to 900 million, or some 64% of the entire population, had been affected by COVID-19 by January 11. The study used data extrapolated from online search queries across the country because of the lack of official figures. Articles referencing the study were promptly censored. In the following days, after weeks of calls for transparency domestically and internationally over China's official numbers, including from World Health Organization, Chinese health officials finally announced that there were nearly 60,000 COVID-19-related deaths at government health facilities in the period since restrictions were relaxed. The majority of deaths were seniors over 65 with underlying diseases, officials said. China had only recorded 5,273 official deaths during most of the pandemic. Jiao Yahue, director of medical affairs at China's National Health Commission, said, "The number of fever clinic visitors is generally on a downward trend after peaking, both in cities and rural areas." According to officials, emergency patients nationwide peaked at 1.526 million on January 2 and then continued to decline. By January 12, they were down 28.4% from the peak. At two packed hospitals in central Beijing visited by ABC News during the height of the wave in December were now relatively quiet this week. The inundated fever clinics at Chaoyang Hospital from mid-December now only had less than a handful of waiting patients. At the China-Japan Friendship Hospital, patient lining up at the respiratory medicine clinic had visibly halved. The constant stream of ambulances to the hospital was noticeably absent, and the non-emergency medicine clinics of the hospital were bustling again. More, China's official COVID-19 stats mask unprecedented surge overwhelming hospitals and funeral homes. Beijing's Dongjiao Crematorium told ABC News that they were still operating around the clock, but demand was less than what they were seeing in December when hearses lined for hours outside.